Hello, my name is Dr. Danny Meisfeld, CEO and founder of D-Analysis Biotechnology and partner along with Nordic Laboratories in our international collaboration known as DNA Life. I'm here today to tell you about a new test that is being launched by DNA Life known as MyGeneRx. It's an incredibly exciting test that should add immense clinical value to you as the healthcare practitioner. But first, let me give a brief background as to who we are. DNA Life is a collaboration between Nordic Laboratories and D-Analysis Biotechnology, and it is an entity dedicated to the training and education of healthcare practitioners, enabling them to accurately and usefully interpret genetic results and transition these into realistic health solutions. We are dedicated to providing healthcare practitioners with training and education. We provide a unique and comprehensive portfolio of genetic tests and an extensive portfolio of functional assessments. We provide the end-to-end solution of education, training and implementation. And DNA Life is a collaborative effort to push the boundaries and give practitioners access to the major developments in personalized medicine. To us, personalized medicine is the recognition of the individuality of every patient that walks into a medical practice, and the realization that a uniform treatment approach is insufficient to ensure the optimal health of the patient. In terms of genetic testing, our emphasis to date has been entirely on nutrigenomics, the study of the effects of food and food constituents on gene expression. Our immensely popular range of nutrigenomic tests are all geared towards a better and more precise understanding of the nutritional, lifestyle and dietary needs of each individual. Today, we move into the domain of pharmacogenomics, the study of how genes affect our response to therapeutic drugs. By way of definition, pharmacogenomics is the study of genetic differences which can affect an individual's response to drugs both in terms of therapeutic benefits as well as potential adverse effects. The goal is to identify genetic biomarkers affecting drug response and use them to make better drug therapy decisions for each individual. Currently, drugs are prescribed to meet the needs of a general population, but genetic variation between individuals can render these drugs ineffective, or worse, lead to severe adverse events. Pharmacogenomics tests are designed to personalize drug prescription, reducing the risk of adverse drug reactions and increasing drug efficacy for each patient. This slide shows diagrammatically how medication is currently prescribed. You have a patient group with the same diagnosis who are given the same prescription. And this patient group can subsequently be divided into 4 categories depending on their response to that particular drug. First, you can have the scenario where the drug is beneficial, but it has severe side effects. Alternatively, the drug has no therapeutic benefits, but still has side effects. The third option is that the drug has no therapeutic benefits and no side effects. And finally, you get the 4th category, which is where we all want to sit, where the drug is beneficial and has no or minimal side effects. The goal of a pharmacogenomics test is to get as many people from the patient group into this cohort as possible, increasing the efficacy of the drug, minimizing the risk of adverse side effects, and reducing costs to the healthcare system. So just some background into the drug market and what it is that we are dealing with. In 2014, the prescription drug market in the US was worth approximately $370 billion, which was a 13% increase on the previous year. But there were 100,000 deaths in the US annually due to adverse drug reactions or adverse drug events. And an estimated 2 million people will be admitted to a hospital every year because of an adverse drug event. The cost of these adverse drug reactions or adverse drug events to the healthcare system is greater than that of cardiovascular disease and diabetes combined. So it is clear that a massive problem exists with the manner in which prescription drugs are dispensed and used, and this is where the science of pharmacogenomics is set to play a role. Armed with the knowledge of which drugs are likely to be most effective and least harmful, doctors can more confidently prescribe medications to their patients. And these benefits are likely to be seen on 2 levels. For the patient, it should decrease the length of treatment time, eliminate the trial and error approach in finding an effective medication, minimize the effects of disease on the body through early detection, and ultimately save the patient money. For the physician, it will hopefully lead to a more successful treatment campaign by preventing the patient from suffering untoward side effects and improving drug efficacy with better results and better patient quality of life. Research into this space has been ongoing for many years now, and today we find ourselves in the position of having a substantial number of drugs with clinically actionable information that is directly related to the results of a genetic test. This is one example of a warning that appears on the label of the commonly prescribed anticoagulant Plavix. If you take note of the boxed text, which I'll read, it says, "Inform healthcare professionals that tests are available to identify genetic differences in CYP2C19 function. Advise healthcare professionals to consider use of other antiplatelet medications or alternative dosing strategies for Plavix in patients identified as poor metabolizers." So this is an FDA warning to users of the drug, alerting to them to the fact that a genetic test exists, and the results of that genetic test are critical to informing the doctor as to the optimal dosing strategies for a patient. In total, 207 drugs exist where FDA-endorsed dosage guidelines are based on or include the results of a genetic test. I'm therefore delighted today to introduce you to the latest offering from DNA Life, MyGeneRx, a comprehensive pharmacogenomics offering analyzing 60 SNPs in critical drug metabolizing enzymes, and that reports on the efficacy or possible side effects of over 100 prescription medications. Some of the classes of drugs that are looked at in the test are antidepressants, antipsychotics, pain medications, statins, anticoagulants, as well as a host of other cardiovascular medications, gastroenterology drugs, and also some drugs related to infectious disease and diabetes. We've undergone a rigorous gene selection process. As with all of the tests offered by DNA Life, we include only those SNPs that have the most scientifically valid and clinically actionable information. And again, with MyGeneRx, every SNP in the test has an evidence level that identifies it as being clinically actionable for the practitioner. Just to go a little bit more into the evidence levels behind the test, the Clinical Pharmacogenomics Implementation Consortium, or CPIC, is a governing body that defines evidence levels for gene-drug associations. Evidence levels 1, where the evidence level is high, means that there is a known clinical implementation, and this information is therefore clinically actionable by the medical practitioner. The vast majority of our genes included in the test fall into evidence level 1 and are clinically actionable. So just definitions of these levels. Level 1A, the annotation for a variant drug combination in a CPIC or Medical Society endorsed pharmacogenomics guideline. Medical Society would be of the sort of FDA. Level 1B, the preponderance of evidence shows an association, and this association has been replicated in more than one cohort with significant p-values and will preferably have a strong effect size. I'd now like to take you to a sample report and give you an idea of what it is that you as the practitioner will see should you decide to offer this test for your patient. The first thing you'll see in the report is the list of any existing medications that your patient may be taking. So all of these are immediately highlighted up front. And I'm just going to scroll down to show you what the key means. You've got the yellow triangles, you've got the green ticks, and this particular patient doesn't have it, but you get the red circles as well. If you see a red circle with a cross inside, it means that a medication has potentially reduced efficacy, increased toxicity, or the patient has an increased risk for the indicated condition. When it's a yellow triangle, it means that guidelines exist for adjusting dosage, increased vigilance, or the patient has a moderate risk for the indicated condition. The yellow triangle would be the equivalent of the 2-star icons that you see in our nutrigenomic range of tests. And finally, the green tick, which means that the medication can be prescribed according to standard regimens, or the patient's risk for the indicated condition is not increased. Also part of this key, you have two words, actionable and informative, which are put alongside the drug dosing information. When it's actionable, it means that recommendations are based upon publications by international pharmacogenomic expert groups, consortia, or regulatory bodies, such as CPIC, FDA, etc. Recommendations are suitable for implementation in a critical setting. As always, guidelines may change as new knowledge arises. When it's informative, it means that there may be insufficient or contradictory findings documenting the impact of a given genetic polymorphism. Recommendations are informative, and implementation in a clinical setting is optional. And this is a scenario where the practitioner may just have a heightened awareness of potential risk or potential adverse drug reactions, and increased monitoring and increased vigilance of the patient should they continue to prescribe a particular drug. So let's go back up to the top and look at the results for the existing medications. Two drugs that the patient is currently taking, amitriptyline and bupropion, have yellow triangles next to them, indicating that based on the genetic results, there is a sensitivity to the drug or a decreased response to the drug. So in this case, it's a sensitivity as a result of the CYP2C19 intermediate metabolizer phenotype, and this is actionable information. And with the bupropion, it's a decreased response due to CYP2B6 intermediate metabolizer, and this is informative. So again, you may continue to prescribe the drug, but you would increase your monitoring and your vigilance of the patient. All of the other drugs that the patient is currently taking, there are no pharmacogenomic interactions with the medication. We come now to general risk management. So this is the second part of the report. It's not strictly a pharmacogenomic section. What we're doing is reporting on any risk conditions or phenotypes which may arise or which may be identified. It's not strictly a pharmacogenomic section of the report. What we're doing is showing you any this is not strictly a pharmacogenomic section of the report. All we're doing is highlighting certain conditions or areas of risk that may be identified because of some of the genes in the test that have multiple functions. So those who are familiar with our DNA health test will recognize quite a few of the genes as well as the phenotypes that are described in this section. For example, we're showing hyperlipidemia or atherosclerotic cardiovascular disease risk because of the ApoE variant. We're showing hyperhomocystinemia due to MTHFR variant, thrombophilia as a result of the factor V variant, and hyperhomocystinemia again as a result of 2 MTHFR mutations. So these are the genes that play multiple roles, and because the genes are included in the test, we feel that we should report on this risk management as well. Next we come down to the crux of the pharmacogenomic report, which is a list of all of the potentially impacted medications that are identified as a result of the particular genotype your patient has. Anti-cancer agents, cardiovascular agents, diabetes drugs, gastrointestinal infectious disease, all of these drugs are included as standard in the MyGeneRx comprehensive test and very easily classified into standard precautions, use with caution, or in some cases consider alternatives. And where the drug falls into the category, as with clopidogrel here, of consider alternatives, it's immediately a red flag that the practitioner needs to be aware of. This drug is not suitable for this particular person, and one needs to consider using one of the other drugs instead. So it's very clearly laid out, really made incredibly simple for both the practitioner and the patient to see the results of the test and what the significance of the test is. And even if the patient is not on many of these medications, this is something that they can carry with them the rest of their lives as part of a health record that can always be referred back to in future should a doctor choose to prescribe or need to prescribe a particular medication. We move on then to the dosing guidance. So any drugs which have the red circle or the yellow triangles, there's now more detailed dosing information. And again, you're told whether it's actionable or informative, and you're told the reason for why you need to decrease the dosing. So, for example, a patient carries one copy of the RS2231142A allele. Studies suggest that this patient's genotype may be associated with a poor response to allopurinol for the treatment of gout. It's a yellow triangle. This is going to be the moderate risk and increased vigilance type of information. So a whole host of drugs that get listed with detailed dosing guidance for the patient. And we come down to the test details. Now we're showing the actual genetic results. And it's should be familiar to most of you who are working with those tests, the gene, the genotype, the phenotype, which is the physical manifestation of your genotype, and the clinical consequences are listed here. So even though it doesn't look like there's 60 here, the manner in which the pharmacogenes are reported, the nomenclature is such that, for example, with CYP2D6, there are in excess of 10 SNPs which result in this genotype call. So it's quite a complicated method of calling the genotype. It's not simply the alleles that we see in our nutrigenomic tests. Here is the list of all of the alleles that do get tested in order to come out with your eventual genotype. And the final aspect of the report is the patient information card. This is something that the patient can cut out, stick in their wallet, and carry around with them. And at any point in the future, when a doctor has the need to prescribe a particular medication, they can refer the doctor to this report and make sure that the drug they are being given is optimal. The other good bit of news is that this entire report will be accessible within the coming months through a digital application. So rather than having to refer to the hard copy report or replacing the patient cutout that he would keep in his wallet, the doctor will simply be able to log into a digital application, call up the patient's report digitally using the unique identifier of the patient, and plug in the name of the drug that he is wanting to prescribe and be told immediately whether that drug is suitable for the patient. And the application will also recommend alternative drugs if that particular drug of choice isn't ideal. So that's a very exciting development that should be available within the coming 2 months. So that's the MyGeneRx sample report. The test is also available as smaller sub-panels focusing only on drugs related to pain, psychiatric medications, or cardiovascular medications. So these panels, known as MyPain, MyPsych, and MyCardioRx, are available individually should the practitioner not want to order the entire comprehensive panel. So let's take a look at who can benefit from these tests. Who are some of the patients where this test might be useful? Well, firstly, you've got anybody who's currently taking medications and is experiencing side effects. In the old days, we'd probably either play around with dosage or tell the patient that the side effects are the necessary evil of being on the drug, but they need to stay on the drug. Now that is not the case, and we can do this test and see if there's an alternative drug that is perhaps likely to reduce the side effects that the patient is experiencing. Then the patient is simply not responding to specific medications. Rather than waste time trying to find the right drug, we get to this right drug straight away. Anyone requiring dosing that is outside of the recommended range, obviously the dosing has been increased because the patient is not responding, and so that's a case where this test would be suitable. And really anybody planning to start a new medication who wants to move away from the trial and error approach of getting onto the correct drug could do this test first off and make sure that the drugs they're taking are most suitable. Just to look at some specific categories of patients, if you take geriatric patients, for example, on average a patient 65 years old is taking 4 medications or more. They often have comorbidities and see multiple physicians for treatments, and it's a population that is vulnerable to falls, to cardiac events, to renal or hepatic issues. Now, there's certain medications that may increase these risk factors. For example, a drug that is going to cause dizziness in certain individuals will increase the likelihood of a fall. And so, clearly, getting the person onto a drug that is going to have minimal side effects becomes very important. If you look at your metabolic patients, we know that cardiovascular disease is the #1 cause of death in the US. Many of the diseases are asymptomatic, such as hypertension, hyperlipidemia, and so the patient's sense of their medication's efficacy is highly variable. Patients that have had a cardiovascular event in the past are twice as likely to have one within the next 10 years. Getting the person onto the right drug that is working, that is reducing the risks of the disease state is absolutely critical to their health. Any patient who's taking chronic or acute pain medications, making sure that these medications are working, minimizing the side effects becomes important. And finally, your mental health patients, where you've got multiple symptoms such as depression, anxiety, bipolar disorder. There's a hugely increasing prevalence of mental health disorders, which is placing an ever-increasing burden on the healthcare system. And finding the right medication generally takes a long time and is done through trial and error. These patients are often told to stay on a drug for up to 6 to 8 weeks before the doctor can ascertain whether that drug is working. And so there's potentially a lot of time wasted if the drug is not going to be effective upfront. So these are just some of the patients where this test would be highly valuable. So in conclusion, pharmacogenomics is set to drastically change the manner in which drugs are prescribed. It really gets to the core of personalized medicine, where patients will receive the right drug at the right dose at the right time. So I hope that you've learned something today. I hope that you are excited about this test as we are. I hope that you can immediately see the potential clinical value that it can add to you. And I want to thank you for your time, and please do not hesitate to contact your DNA Life sales agent if you have any questions. Thank you very much.